So my name is Tye Perrett. I'm a veterinarian and I work at a company called Feedlot Health Management Services. We're a company that provides data and information and consulting to feedlots North America and globally. My role here is related to veterinary medicine to some degree. I also spend quite a bit of my time managing the business and overseeing what we do relative to our services and relative to our pharmaceutical supply to our clients, which is one of our services as well. Well, probably a few reasons. One of them being that it's clearly an important topic publicly, for the public as they look at much of the information that comes out in the lay literature, and certainly among veterinarians as the scientific literature comes about. It's an important topic. It's one that is important relative to the sustainability of human health, sustainability of animal health, and then the sustainability of the industry that I'm involved in relative to animal agriculture and specifically beef cattle. So to be involved, to be proactive, to be aware of what's happening and contribute in any way, I think is part of my professional responsibility and part of the responsibility I have to represent our clients, quite frankly. Yeah, I think for sure they have. Certainly there'd be some veterinarians that may not be as aware or not maybe as top of mind for them, but the vast majority, I think, certainly would be. Anybody that's involved in day-to-day veterinary practice, veterinarians that are involved in government or industry, it's a topic that comes up regularly. If you look at what much of the continuing education or conference topics are that we attend as veterinarians, it's a common topic. If you stay up with the literature, it's a common topic there. And quite frankly, our producers, our clients have questions about it as well. So it's a topic that's routinely discussed. And as veterinarians, as we talk about what we're going to do protocol-wise relative to antimicrobial use in our practice, those are considerations that come up. There probably are some differences. I'd probably start off by saying that in general, there's probably a fair amount of congruency in views relative to or between veterinarians that serve animal agriculture and producers. I guess I can speak from my experience with our beef producers that much of what we think about and how we think about the future and the sustainability of the industry are fairly well aligned. And we may touch on some of that later, but clearly our producers feel like it's an important topic. And I think much of the public sees that as well, but there's another component there, at least some portion of the public that may have a different view and have taken the more extreme approach of maybe total removal of access to antimicrobials, or have wrapped that into other issues that some interest groups might have against animal agriculture. And so there probably are some macro differences there. When you look at veterinarians, again, I think I mentioned those that are involved in animal agriculture. I think we collectively have the same view of the importance of AMU and AMR. And, as I said before, relative to where we go from here. So those views and perspectives aren't too much different. The industry, if you will, the producers, they want to be sustainable going forward, and they want to be able to use antimicrobials in an effective way. And I think veterinarians think the same way. Yeah, I think generally veterinarians are looking for more information relative to antimicrobial resistance and valid scientific facts, scientific literature. And I think what the CVMA is doing as far as collating or providing a resource that connects directly to AMU, I think that's an important resource. And I think many veterinarians will be either already aware or will be interested in looking at that. I guess I would note that one of the things to consider is that there are many factors that go into decision making relative to how antimicrobials are used. And so the information provided, I think, is a useful guideline, and I think that's a key element that then from there veterinarians need to use their clinical judgment, use an understanding of the situation, and use their training to make decisions that are best in that case. But it's great to have a place to start. I don't think it's going to be the answer in every situation, but more information, I think, is generally better. Yeah, I do. I think it's an important component of actually beginning to understand where we are as veterinarians. What are the characteristics of the prescribing and dispensing practices that are currently occurring? Because without that baseline, we're really making estimates, we're making guesses about what is happening, and then very difficult, I think, to then begin to make any plans relative to improving antimicrobial use or mitigating antimicrobial resistance. So I'm sure there'll be some logistics to work through in that, and there's a fair amount of data to collect. But I can speak, I guess, from the feedlot industry's point of view. Much of that data is already collected, and I would encourage that to be focused on antimicrobial use as opposed to antimicrobial prescribing. I think it's probably clear, but those two don't always match up, and certainly having the actual use data provides another layer of information I think could be useful. That data is available, and within the feedlot industry anyways, there's an opportunity there to work with a relatively small number of veterinary groups that would get much of that information and provide a really good base. Not only how much is used, where it's used, and the application under which it's used, I think is important. I think that's one of the key challenges for the industry is the public pressure that comes on either retailers or food service that really is concerned about antimicrobial use, but may not be fully informed as to all the reasons that antimicrobials are used in animal agriculture. And so you're right, there are suppliers who will dictate, if you will, certain situations and antimicrobial-free production. Those things, that can happen, but I think one of the elements that's missing in that is that antimicrobial use is important for the animal well-being and animal welfare and animal health. And to ignore that component of antimicrobial use is probably dangerous, in my opinion, relative to the animal. And so sometimes that gets lost in the conversation. And so, yeah, certainly producers feel that kind of pressure, particularly when it comes back from those that they supply and affects the economics of their business. That's an important part. And more importantly, producers, and veterinarians feel that they have a stewardship for the care of these animals, and to have their hands tied in a way that doesn't allow them to use the tools that are in the toolbox to maintain the health of their animals, that's a difficult dilemma to be in. And so, yeah, that's a real concern, and it comes and goes, but you end up being potentially handcuffed in a situation that producers don't want to be. One of the things that gets lost in this somehow is the assumption that the industry, speaking of beef producers here, are using antimicrobials either indiscriminately or at the expense of maybe alternatives, meaning that it's just an easy fix. And I guess I'd just like to highlight that if there was a solution that was effective that would be an antimicrobial alternative, the industry would be using it. It's not like as veterinarians or producers, we're sitting on the sidelines and just using antimicrobials because we don't have a better solution. And so that, I think that leads to the next important point, is that I believe, my personal opinion, that science and innovation will lead us down a path that's going to solve this. I don't know how long that takes, but what that does mean is that there will be new technologies, use that in the broadest term, that will allow us to manage animal health and animal well-being, animal welfare in a way that doesn't necessarily require the same amount of antimicrobials or having them used in a different way. And so that's a key element in this discussion. Further to that, what gets lost sometimes from the public's view of this is that in feedlot production, we're using antimicrobials in a very targeted manner. There's data to determine, what are the potential outcomes, and what, from an animal health perspective, and what can we do to mitigate those. And so antimicrobials are used where needed, as needed, and that targeted use is, I think, going to be important even going forward as we talk about keeping these animals safe, healthy, maintaining a reliable food supply. So again, that's probably an overarching topic, but it's one of the things as we talk to producers, we talk to our clients, we talk to other veterinarians in animal agriculture, sometimes gets missed in all of this. So I think that's important. And I'm optimistic about the future. There's real concerns, or there are real concerns, but the human race is remarkable when it comes to being innovative and being science-based. And as long as we're science-based and we don't end up being taken down a path that gets us away from science, the human race will solve it to some degree.